It's Dr. Bansukan or Dr. B again, and this is the second topic, which was the second question that was confronted to me, and I will try to answer it in an easy way. The question is what to do with sinus infection, sinusitis. Well, it's usually due to some form of congestion which started in the nasal cavity and up to the sinuses, and they become infected because of poor drainage of the sinuses, especially the maxillary and the frontal sinuses. Sinusitis is an inflammation of the lining of the sinus cavity, and when it gets infected, it is usually due to a mixture of organisms: Staphylococcus aureus, strep, Haemophilus, Klebsiella. The way we handle sinusitis is to treat it with antibiotics and decongestant. The antibiotics is to fight back the existing infection, and the decongestant is to promote sinus drainage. And there are a variety of decongestants available around. Claritin is one of them. 10 milligrams once a day is sufficient to promote sinus drainage. The etiology or the cause of sinusitis is usually bacterial infection, and that can be treated with broad spectrum antibiotics such as azithromycin, 500 milligrams daily. There are some nasal spray available to promote shrinkage of the lining of the sinuses, thus promoting drainage of the sinuses and relieving the congestive symptoms that is present with sinusitis. One of the sequela of chronic sinusitis, especially those with acute exacerbation, is what we call sinus headache, and they are usually frontal in location. And if indeed there is a definite evidence of sinus infection, then it should be treated. Otherwise, those patients with recurrent sinusitis or the recurrent sinus headaches, they should be rechecked to make sure that the headaches are not due to some other causes. Sinus headache is pretty common, but on the other hand, one has to worry about the other causes of headache, such as headache due to increase in intracranial pressure secondary to a space-occupying lesion. So most of these patients will need a CT scan of the brain to rule out intracranial abnormality. Otherwise, for a plain old sinus infection, antibiotics and decongestant is all that you need. Thank you very much.